name's Marcy Borowski, and I'm a psychiatric mental health nurse practitioner. I have been doing this for about 12 years. I work with patients of all ages, and I have experience working with people in the inpatient units, outpatient departments, residential treatment. I worked with individuals with substance use disorders, and I've spent a lot of time working in rural communities across the country.
My name is Jess Reed, and I'm an outpatient care coordinator and a behavioral health navigator. My background in education is social work. But I also have a master's in special education.
My name is Andy, and I am one of the behavioral health navigators here at the hospital. We're a county-wide service, so I've even gotten calls from people that are not patients of Middle Park Health. And my role here is to either connecting you to the right therapist or to a good fit, or providing you some brief therapy depending upon kind of what the need is.
In rural communities, there's always a lack of access to professionals.
Not really wanting to address mental health, very stigmatized. So there are a lot of issues that we face in the rural community.
A lot of people don't like seeing practitioners over the computer or over the screens, and having someone in person can be really helpful.
Growing up in a very isolated mountain town, I do understand a lot of the difficulties that there are up here. They don't know how to connect, or they don't have anybody up here to help them figure out the resources that might be available. And so we do see a heightened level of mental health services that aren't being serviced up here.
We live in an area that is very self-reliant, and people don't want to be a burden. The healthcare process, unfortunately, is a very convoluted and overwhelming thing, whether you are a young professional that has plenty of education, or someone who is a senior that doesn't use technology. It just is an overwhelming thing. And so you would come to me and say, hey, I think I have these benefits, but either I think I got dropped, or I'm not sure what those benefits are, and we can help you navigate that.
As a psychiatric mental health nurse practitioner, my job is to assess, diagnose, and treat mental health disorders. It's rewarding for me to meet with an individual, really go through what kind of a good history of what they have had going on, and dig into what may be contributing to their mental health problems.
Working in a rural community, oftentimes we have to wear many hats, and so sometimes that includes helping to reduce some of the social determinants of health and barriers to people's access, such as transportation issues, ability to pay, helping a lot of our elderly populations to manage some of their appointments as they start to get, more complex needs. And we're also very savvy with all of the resources in the community to help fund mental health services for people. And so that's the primary goal of the behavioral health navigation. And we don't just work with people that are here at Middle Park Health seeing doctors. We work throughout the whole community.
I also encourage people, hey, you got a lot on your plate, whether it's a new cancer diagnosis or injury that is just kind of sapping all the mental resources that a person or their family members have. Just today I was working with a family that had a new cancer diagnosis, and hey, if you want me to submit these forms to the Mountain Family Center for their cancer fund, I'm happy to do that, because I understand, or I can at least understand or try to understand what you're going through as a family and just how overwhelming all of this can be. And if I can unburden you from some of that stuff, that's my goal.
It is complimentary. There is no billing for anyone.
It's something that the hospital provides free of charge, which I think is an amazing service. That's wonderful.
A lot of people are referred to my services from family members, from primary care providers, from therapists, and a large majority of my patients or individuals show up and they say, I really don't know why I'm here. I've been going through it.
Every Tuesday I am at Alpine Sun or Byers Peak Family Practice. They share an office in Winter Park. So I'm there to offer behavioral health navigation services from 1 to 5 o'clock until their end of business. We get called out to Winter Park Ski Resort whenever there's a critical incident there. That me and my colleague Jess were just there yesterday. There were 2 incidents over the weekend that they felt like their ski patrol staff needed some additional support, and we were there for a combined 11 hours to offer support, resources for ski patrollers and staff.
I really enjoy the work that I'm doing so much. It does bring me a lot of joy. It really is important to me that everybody has access to care. One of the situations that I enjoy working with are younger females up here. Start with the children and help make them healthier, because that is our future. I've had a few really great success stories with some young girls up here with some anxiety, and teaching them about their brain and trauma and all of that. And that's just very heartwarming to get to see that whole process for them.